At 5 with the coronavirus and the newest numbers that have come in from the past 5 days. The state reporting 86,009 new cases over that 5-day period, averaging out to 17,000 cases per day. 501 more Michiganders have lost their lives to COVID-19.
Now take a look at the 7-day moving average. It is still very early, but it seems new cases could be starting to level off a bit, but you still have to keep in mind testing numbers are going to be lower because of the holiday weekend. Along with today's update on the state's COVID numbers, Henry Ford Health System also gave an update to talk about some hopeful signs that are starting to emerge.
Dr. Frank George, of course, works in the ER at Henry Ford. He's here with the latest. But first, I want to get your reaction to today's numbers from the state as we've now broadened these out to a 5-day total coming in at once, Doc.
Well, you know, Devin, based on today's marginally improved Michigan numbers, I'm still going to stay optimistic and hope that we're seeing a continued plateau or hopefully maybe even a decrease in case counts. Now, of course, it's a big state and not all of Michigan started the current Omicron spike at exactly the same time. So some counties are going to have different levels of activity. That said, if the Henry Ford Health System is used to gauge activity here in Southeast Michigan, the trend is also favorable.
After weeks and weeks of giving you really sobering news, I'm really happy to report that we are starting, and I emphasize starting, to see a trend that we hope will continue of decreased hospitalization. Overall, our census for COVID hospitalizations have declined since Monday, when we had 551 patients hospitalized with COVID, to this morning, that number being 499. That number includes 2 children under the age of 17.
That's Bob Riney, Chief Operating Officer for the Henry Ford Health System.
Another hopeful sign that we're seeing is the number of people getting infected every day is also slowing. So this is again something that gives us great hope. This morning, our positivity rate for all lab testing was 33%. That is down from 44% that we were trending in the first part of January.
Although these numbers are all moving in a good direction, he emphasized something else that's making a difference.
The data on people being hospitalized without a booster is quite striking, underscoring the importance and benefit of that third dose for added protection. More than 90% of all hospitalized people for COVID or in an ICU or on a ventilator did not receive a booster.
Now, Henry Ford also discussed the ongoing nursing crisis. Now, of course, COVID is making it worse, but even if COVID went away tomorrow, we would still have a severe nursing shortage. To help relieve it, Henry Ford has embarked on 2 initiatives. They're recruiting nurses from the Philippines, and they hope to have that first group begin this summer. They are also recruiting heavily from the MSU Nursing School that is partnered with Henry Ford.
So, Frank, any opinion on the national numbers for new cases that we're seeing?
Yeah, you know, we've already seen some East Coast regions look like they have peaked from their Omicron surge. But that said, it's a big country, and different areas started their surge at different times. So the rise and fall nationally might end up looking a little more drawn out. But for areas like ours that saw an early rise, we actually hope the drop will be sooner as well.
Boy, we sure do. All right, Doc.